Welcome to our module on diabetes prevention and control. This presentation is for educational purposes only and not for medical advice. Topics covered in this video are diabetes prevention and diabetes control for type 1 and type 2 diabetes. As we have said before, these are the two types of diabetes mellitus, type 1 and type 2. Unfortunately, type 1 is not preventable. On the other hand, type 2 diabetes mellitus is preventable with healthy lifestyle choices. The key lifestyle choices are listed on this slide: diet, exercise, and stress management. Here are some examples of foods that may increase your risk of type 2 diabetes: white bread and pasta, fries and chips, sauces like ketchup and barbecue sauce, juices like orange juice and apple juice, sport drinks like Gatorade and Powerade, and lastly, desserts like candy bars, hard candy, soda cakes, pies, cookies, and ice cream, and they're all very high in sugar. You may be wondering, what can I eat? Here are some healthy options you can add to your diet. This is not a complete list by any means, but some vegetables you can consider are leafy greens, green beans, cucumbers, carrots. For meat, grilled or baked chicken, fish, or turkey might be some good options. Eggs are also very healthy and high in protein. For snacks, nuts and plain popcorn. Sauces like mustard and hummus are also a good option. For oils, olive oil is a good choice, and fruits like apple, berries, and pears are also good choices. Another great way of prevention for not only diabetes but for many diseases is by exercising. The CDC says to exercise for 150 minutes per week, but what does that even look like? Walking 30 minutes 5 days a week, or for even just 10 minutes several times per day, can help you achieve that goal. Exercise doesn't have to be boring. There are many other activities you can do to get your exercise in. You can go biking or swimming. You can also mow the lawn or do chores around the house. Dancing and hiking also count. Stress plays a big role in many diseases, especially in diabetes. Managing your stress can be done by focusing on your mind, body, and spirit. To help ease your mind, set aside time to do things you love. For physical stress, try stretching or yoga or deep breathing. Aim for 8 hours of sleep per night. Lastly, stay in tune with your spiritual health, whether that is through prayer, journaling, or meditation. Time for a checkpoint. So far, we have talked about 3 main ways to prevent type 2 diabetes. These are diet, blank, and stress management. That's correct. Diet, exercise, and stress management are all areas that can, if improved, reduce your risk of type 2 diabetes. Now we will talk about controlling diabetes. Controlling type 1 diabetes is done by monitoring blood sugar. This is commonly done by a device called a glucometer, as seen here on this slide. Another important way of controlling type 1 diabetes is by taking the insulin prescribed to you by your doctor. This is absolutely necessary. Control in type 2 diabetes is similar to prevention of type 2 diabetes. All the lifestyle choices mentioned earlier can be used to control and improve your type 2 diabetes as well. Your doctor may also prescribe medications to help with control as well. All right, let's review what we have learned so far. We have our 2 types of diabetes, type 1 and type 2. Although type 1 cannot be prevented, it can be controlled by checking your blood sugar and taking insulin medications that your doctor prescribes. Type 2 diabetes can be prevented and controlled with healthy lifestyle choices. Your doctor may also prescribe medications to take as well. Almost done, but first a checkpoint. List 1 way in which you plan to work on preventing or controlling diabetes in your own life. Want to know more about your own risks for diabetes? Follow this link to figure it out. Want to learn more? check out these websites for extra information.